Any parent who's gotten up in the middle of the night to change their child's sheets will tell you bedwetting can be troubling for the entire household. But what can be done about it? Dr. Nour Baltagi, a pediatrician with advanced training in nephrology at Essentia Health in Fargo, says parents shouldn't be concerned about bedwetting before the age of about 5. If a child older than that is wetting the bed, there are several possible reasons why. Genetics. They're more likely to wet the bed if one or both parents did. Delayed maturation of the bladder and nervous system. They have a small or hyperactive bladder, a urinary tract infection, or they're drinking too much before bedtime. Sometimes constipation is causing bladder pressure. Dr. Baltagi says bedwetting is physically pretty benign, but psychologically it can lead to behavior issues and low self-esteem.
These kids, many times they don't socialize, they don't want to go for sleepover, they don't want to go to summer camp exactly for this reason.
Dr. Baltagi says parents can try to stop the bedwetting on their own by encouraging their children to eat more vegetables to alleviate constipation, and also limiting foods that make them thirsty. Also, consider a beverage budget of sorts. Let kids consume 40% in the morning, 40% in the early afternoon, and just 20% in the late afternoon. If that doesn't work, Dr. Baltagi says to see a physician who might prescribe an antidiuretic pill or suggest you use a bedwetting alarm, which sounds with the first drop of urine.
The bedwetting alarm, it is kind of conditioning treatment. It will tell your brain to inhibit the bladder reflex.
Dr. Baltagi says most children will outgrow bedwetting, but the worst thing parents can do is punish the child for it.
That does not help. The kid will have more low self-esteem, and it doesn't help because it's not their fault.
With this Essentia Health Medical Insight, I'm Tracy Briggs.